मेडिकल रिप्रेजेंटेटिव्स होते हैं, सेल्स बढ़ाने का उनका काम होता है मार्केटिंग प्रिंसिपल के हिसाब से, सेल्स एजेंट होते हैं बेसिकली। फिर वो कहते हैं साहब अब हमारी जो दवा है यही लिखना, ये बहुत बेहतर दवा है, इससे मरीज ठीक होगा। और उनको डॉक्टर्स को लिखने के लिए उनको प्रेशराइज किया जाता है, उनको टेम्प्ट किया जाता है।
Welcome to our series examining how India's current trajectory mirrors some of the challenges faced by the United States, particularly in critical sectors like healthcare, education, and housing. In this inaugural episode, we delve into the escalating costs of healthcare in India, a nation historically dubbed the pharmacy of the world for its affordable medicines. Yet today, medical inflation is soaring, averaging 10 to 12% annually over the past few years, far outpacing general inflation, threatening to turn healthcare into a privilege for the wealthy rather than right for all. From advanced treatments to rising hospital bills, the drivers are complex. Technological advancements, a shortage of doctors, 0.79 per thousand people in 2024, and a reliance on private care where costs can triple public options. This shift burdens households, with 39.4% of health spending still out of pocket in 2021, pushing millions into poverty each year. In this episode, we unpack the numbers, policies, and real-life stories behind India's healthcare crisis. Join us as we explore a system at a breaking point and what it means for the average citizen.
প্রথমবার আমরা অনেক কষ্ট সৃষ্টি করে সব পয়সা জোগাড় করে কলকাতায় জমা দিয়ে এখানে অপারেশন 5 বছর বয়সে তখন বললো ওর আবার সার্জারি দরকার, আর একটা ব্লকেজ হয়ে গেছে, একটা নষ্ট হয়ে গেছে।
लास्ट ट्रिप जो हम लास्ट एपिसोड वहाँ पे एडमिट हुए थे तो बच्चा तब बहुत सीरियस ही हो गया था, उसका बॉडी पूरा फूक गया था, आंख में पानी भर गया था।
बहुत फीलिंग है, बहुत परेशान।
I always wanted to build a large health city with 5,000 beds. Only way the cost of high-tech healthcare will come down is by economy of the scale.
India's healthcare system is a tale of two worlds. Public hospitals, overcrowded and underfunded at just 1.84% of GDP, serve most citizens, while private hospitals offer cutting-edge care at a premium. Over 62% of healthcare services now come from the private sector, a gap widened by shortages, one doctor per 854 people, and a growing demand for quality. This divide mirrors the USA, where private care dominates at 17.4% of GDP. In India, private bypass surgery costs 3 to 4 lakhs versus 1 lakh in public hospitals, driven by better infrastructure and shorter wait times. But for rural India, where private clinics outnumber public ones, access remains a lottery, leaving the poor reliant on an already strained system. Without reform, healthcare could become a luxury. In 2021-22, out-of-pocket spending dropped to 39.4% from 64.2% in 2013-14. Yet it's still 4 times the USA's 10.7%. For millions, this means debt or no care at all.
Now, in a major development, the National Pharmaceutical Pricing Authority has announced a hike in prices of around 800 essential drugs from the 1st of April.
High costs hit hard. 39.4% of India's healthcare spending in 2021-22 was out of pocket, down from 62.4% in 2018. For the bottom 20% earning under 50,000 per year, this can devour 30% of income, forcing tough choices, sell assets, borrow or skip care. Compare this to the UK or Canada, where out-of-pocket costs are just 13.5% and 14%. In India, high OOPE traps 30 to 39 million people in poverty yearly. Only 37.2% of households have insurance, and even then, the coverage is spotty, leaving families exposed. When a 3 lakh cancer care treatment means selling a shop, the system's flaws are clear. Without price control and broader insurance, financial ruin looms for millions. Insurance costs highlight the gap. India's private premium averages 12,000 rupees a year, while in the US, employers' plans hit $800,435 a year for individuals. That's 7 lakh rupees. Only 15% of Indian workers get employee coverage, leaving most to fend for themselves. India's plans focus on hospitalization, 5 lakh rupees under Ayushman Bharat, but skip outpatient care, driving up 39.4% of out-of-pocket expenditure. In the US, plans cover 70 to 90% post-deductible, yet premiums soar due to high provider costs. Medical inflation rates at 14% in India, whereas 8% in the US, means skipped meds here and delayed care there. Consolidation risks loom. The US top insurers hold 80% of market share, pushing costs up. A future India might face as insurance grows at 11.55% CAGR without reform. Its bikes sold here, credit max there. Becoming a doctor in India is a costly gamble. 2.3 million students vied for 1 lakh NEET seats in 2024. Government colleges charges 6,000 to 50,000 per year, but private ones demand 2 lakh to 25 lakhs a year, a burden giving debt or overseas careers. India trains 90,000 doctors yearly, yet the ratio of doctors to patient is quite irregular. High fees push 20% abroad, while urban doctors earn 15 to 25 lakhs per year versus 5 to 10 lakhs in rural areas. Rural posts lack support, leaving 70% of the doctors in cities for 30% of people. Expensive education limits who can heal and where. Without affordable training, healthcare access stays unequal. Now let's come to Ayushman Bharat, which targets 500 million with 5 lakh rupees per family per year. By 2023, it cut out-of-pocket expenditure by 21% for 107 million families. Yet, only 50% of eligible families are enrolled, and 30% of private hospitals opt out over low rates. India spends $83 per capita on health, trailing behind Vietnam's $166. At 1.84% of GDP, it's dwarfed by USA's 17.4%. Advocacy groups like Jana Swastya's 2022 rallies pushes for more. Public pressure works, securing a 10% rural health budget hike in 2024. Transparency and equity are key to the real change. India's healthcare teeters on a cliff. Rising costs, a public-private chasm, and a 39.4% out-of-pocket expenditure echo the US's unequal path. Ayushman Bharat helps, but broader coverage, price caps, and rural investment are vital to make healthcare a right, not a luxury. Next up is education. Stay tuned to Prism Bharat for more such videos. Let us know in the comments below what did you think about this piece and what kind of videos would you like to see in the future. Subscribe and like for more such videos.